And you're welcome back. The National Health Insurance Authority says it is counting on the health facilities to engineer the growth of the scheme by stopping illegal charges of their clients. According to the NHI, such illegal charges reduce the confidence of their clients and force them to withdraw from the scheme. Speaking at the end of year staff dip as part of their 25th anniversary celebration in the Central Region, the Central Regional Director of the authority, Fred Apia, says the region is hoping to meet its target that they've set for themselves.
National Health Insurance Authority, since the launch of its 25th anniversary celebration, has been engaging in a series of activities aimed at shoring up its subscriber base. In the Central Region, there have been blood donation exercises as part of their corporate social responsibility. Regional Director of the authority, Fred Apia, says the authority is counting on the support of the various health facilities to help grow the numbers of their clients.
The key of those challenges is what we term it illegal charges. You know, when our members go to the facilities, sometimes the facilities, they charge our members. This is not giving them the confidence to renew their card. So we are saying that providers, we want you to give the services to our members. Once you do that, they will continue to renew their card when it expires. In some of the districts, connectivity is also a challenge. And so we are also appealing to the telcos to also help us. But in most of the districts that there are challenges, please, when they are connected, members will get there and then they begin to also get a connection to get their card. We are saying also that some also have few logistical challenges, and I believe my management, headed by Dr. Bernardo Kobo, they are doing their best. This year, several logistics has been given to us, and I know next year they will do more to help us achieve our target.
Mr. Apia wants people to take advantage of the self-service and join the scheme.
You know, the newest of our innovation is the app that has come on board. With this app, it's very simple. You can just be in your house, just sleep. And then when you get up, you just take your phone, you download the app, and then you are good to go. What you are saying is that it's very important. You can use it to renew your card for yourself. You can do for a third party. You can also use it to do new card for yourself and for somebody. In this same app, you can download all the services that insurance covers. So this app is very good. We entreat everybody in Ghana to make sure that you use the app. We want to achieve universal health coverage. Our target is that. And so as a nation, if you're able to get at least 80% of our population, it will help us.
The end of year staff there brought together the staff of the authority and some of their stakeholders to reflect on the activities of the authority in the year under review. Reporting for Joy News from Cape Coast, Richard Kujidako.
And now the Sekyere East District Health Directorate is calling for public collaboration in addressing rising cases of the neglected tropical disease. District Director of Health, Dr. Justice Sekyere East, who made the call, emphasized the urgent need for external assistance to effectively control and manage the cases. He spoke at the launch of the fight against neglected tropical diseases at Ifijase in the Ashanti region.
Senior Director Kasan Okai said, "Utidi neglected now. Ya tusa in your way a JJ and che bina COVID a unity or cream for my Ghana will be a Dimrica."
Neglected tropical diseases, NTDS, are a group of 20 viral, parasitic and bacterial diseases, primarily afflicting over 1 billion individuals among the world's most marginalized populations. According to health authorities, Ghana is grappling with 14 NTDs, with each district across the country documenting the presence of at least 2 of the diseases. Advertay is a chief biomedical scientist at the Neglected Tropical Diseases Program.
About my Ghana, you do 914.
Ghana has 14 neglected tropical diseases, and every district in the country has at least 2 of the diseases.
District Bay and Ofibaya. As some as the coffee say, opinion of in crime by and district high, one mania.
In 2023 alone, the Sekyere East district has reported 2,471 instances of scabies, 22 cases of lymphatic filariasis, 55 cases of yonks, and 5 cases of leprosy. Sadly, there have been 7 deaths among children due to rabies cases. Now let's hear from the District Director of Health Services, Dr. Justice Ofori Amwa.
Sekyere East has so far recorded about 2,471 cases of scabies for the year 2023. We have recorded 7 deaths associated with rabies. We have also recorded 55 cases of yaws. We have also put 5 cases of leprosy on treatment, and the cases are reporting. Again, we have about 22 cases of lymphatic filariasis. All what we are preaching and saying to the general public is the early reporting of any suspected case to the nearest health facility for case management.
What might explain the higher number of cases in comparison to the previous year? Dr. Justice says,
since the last 3 years, the figures keep increasing. All is because the World Vision supported us in case search. The Women's Hope Foundation also supported us in case search. And the more we search, the more we get. It means that the cases are in the communities. So the best we can do is to go out there, talk to people, for all to report any case that they see that looks abnormal to them. Then we will now classify that this is leprosy, this is scabies, this is lymphatic filariasis. And with this, again, we are able to eliminate the disease from the district.
The incidence of these diseases has had a detrimental impact on the economic and social well-being of residents, particularly affecting school-going children and farmers. Dr. Nana Ayu Afriye, the Member of Parliament for Efiduase Asakore constituency, who launched the campaign, has affirmed that his office will persist in aiding the district health services to oversee and address the situation.
It's preventable. It can be treated early stage, looking for the case, the official case, Capacity building, training.
The diseases are preventable and can be treated. Capacity building for health personnel is crucial, so I have looked for the money for all this.
Around the I looked for the money, and I looked for the money, and I have looked for it.
So we can start our campaign with what we have now. Chiefs, opinion leaders, politicians, teachers, and residents are urged to collaborate with the Health Directorate in identifying, treating, and monitoring cases of neglected tropical diseases. This call to action was emphasized by Dr. Justice Thomas, the Municipal Director of Health Services for Achumanwa-Abinja District and the National Chairman for the District Directors Group.
That there are 3 things to be done if we want to get anywhere on this particular matter, and that is to search, to treat, and to track. If you don't look, you can't find. And if you want to find something of interest, you must look out for it.
The World Health Organization advocates 5 fundamental strategic interventions to expedite the prevention, control, elimination, and eradication of neglected tropical diseases. These include innovative and intensified disease management, preventive chemotherapy, vector control, veterinary public health, provision of safe water, sanitation, and hygiene. A report by Mohamed Nuruddin.